Recording. Yeah? I can't see you, so you're gonna have to.
Yes.
Okay. So we did attachment-based family therapy by Cheyenne, Destiny, Courtney, Danielle, Ilana, and Kaylin. So the approach and founder, the name of the approach is attachment theory, founded by John Bowlby. Mary Ainsworth is known for her contribution to the theory and her studies on attachment in infants. John Bowlby researched and studied the concepts that are now part of attachment theory in the 1950s and 1960s, and also published articles on his findings. Mary Ainsworth took the research and knowledge she gained from working with Bowlby and created the first empirical study of infancy in Uganda in the 1950s. Data collected from Ainsworth's study was shared with John Bowlby and was later included in the first volume of his attachment trilogy called Attachment, published in 1969. Some key terms and definitions for this theory include internal working models, which considers the patterned responses to the social environment and the capacity for ongoing revisions based on learning from new social experiences. Proximity maintenance is the desire to near people we are attached to. A safe haven is returning to the attachment figure for comfort and safety in the face of fear or threat. Secure base is when the attachment figure acts as a base of security from which a child can explore their surrounding environment. Separation distress is the anxiety that occurs in the absence of the attachment figure. And then the four different attachment patterns are secure attachment, which occurs when there is a healthy emotional bond with the caregiver and the infants feel secure to explore the world around them. Avoidant attachment occurs when an infant does not form a secure bond with the caregiver, but they will still explore the world around them, typically results from the caregiver not meeting the infant's needs over the period of time. Resistant attachment, also referred to as anxious or ambivalent attachment, is where there is an insecure bond formed, but the infant becomes distressed when the caregiver leaves and becomes avoidant or upset when the caregiver returns. And then disorganized attachment occurs when the infant appears confused when the caregiver is present or absent because they see their caregivers as a place of comfort and distress. Some core tenets of this theory include it aims to support members of a family to create meaningful and secure relationships with each other, which can help address family conflict and work through issues to strengthen relationships between children and caregivers. It supports members in expressing their concerns in positive ways to those who they are having problems with, as well as helps the receiving members respond appropriately. So, supporting family members in a controlled setting, such as this, therapy, allows them to develop new skills with the feedback from a worker and strengthen them to be able to incorporate at home in real life situations. It leads family members to practice emotional regulation and develop conflict resolution skills, which is again following members to reenact scenarios they experience at home in a setting with a worker during therapy, can promote healthy conversation and relationships in the future. So, overall, this therapy approach works to allow members to understand not only their own perspective, but those of others too, and developing skills to address issues in a positive way supports a healthy family dynamic and builds stronger relationships. And then a few goals of this theory include improving family functioning through the development of healthy communication skills and addressing concerns, improve attachment between members, decrease family conflict, enhance emotional regulation for members to be able to have calm conversations, and look at the family as a unit as they function together. So the overall goal is to improve family functioning and support members of a family in addressing concerns within relationships and improve healthy functioning.
The role of the therapist and counselor is to create a safe and trusting environment to allow all members to express their emotions. The role of the therapist and counselor is to encourage individuals to be supportive of each other. The therapist acts as the bridge slash mediator between the adolescent and the caregivers. The therapist promotes and encourages secure attachment and also models this behavior. The role of the therapist and counselor helps the identify unhealthy relationships and provides support and empathy. The therapist will guide the clients to empathetic interactions, expressing difficult feelings between family members. The role of the therapist and counselor teaches and provides psychoeducation during treatment. The therapist advocates for all members to ensure everyone's voice is heard during treatment services. The therapist helps with emotional processing and process avoided and stressful events. The therapist helps caregivers consider how their own life stressors and intergenerational legacies and beliefs of attachment affect their ability to connect with their child. Clinical interventions include relation reframes. This helps shift the focus from the mental health symptoms of the adolescent to the rupture in the relationship between the caregiver. This helps families see how the relationship is impacting the distress and helps the family to improve the relationship. Emotional processing helps the clients express emotions that are underlying with anger. Attachment task. The therapist helps guide emotional and vulnerable conversations between the adolescent and caregiver. The therapist helps caregivers respond in non-defensive, empathetic, and validating manner. This helps repair trust and encourages new relational patterns based on empathy and safety. Therapeutic alliance. The therapist holds individual sessions with both the adolescent and caregivers. This helps the family establish healthy boundaries and respect. Clinical techniques used. The therapist helps identify core emotions with the clients, coaching and communication, providing attachment-based psychoeducation, reenactments and role play. This helps individuals and caregivers process and view painful events to heal. Attachment-based homework assignments between the adolescent and the caregiver, mindful exercises, and narrative techniques. Some cultural considerations to consider are the family structure and hierarchy. What are the beliefs and values regarding gender roles and how the roles influence attachment and how they express them? What are the parenting styles and beliefs? The language and communication styles, trauma history or systematic trauma, emotional expression, is it discouraged in their culture? Religion and spiritual beliefs regarding mental health services, and intergenerational conflict.
So, this is the case analysis of what's eating Gilbert grape.
Who did this one?
So in regards to analyzing the Gilbert family using attachment-based family therapy, I just want to discuss the definition of attachment-based family therapy, which is a mental health treatment designed to help treat depression in adolescents and young adults. The goals of this type of therapy, it helps rebuild trust between adolescents and their parents, and it helps reestablish the parent's role as a form of support for the adolescent. So the effectiveness of the attachment-based family therapy for the Grape family. So in the movie, it is seen that there is lack of support from Bonnie towards her children due to her severe depression. The children and young adults in the home are also overwhelmed due to the many household responsibilities, such as grocery bills, household repairs. There's also lack of support in supervising and managing Arnie's behaviors, leading to increased stressors for the family. By having a secure relationship, attachment between the adolescent, young adult, and their parent allows for more regulated emotional distress and promotion of autonomy. So the 5 treatment tasks related to this therapy. Task 1 is relational reframe. So the goal of this task is to shift the focus from the adolescent behavior to help improve family relationships. So in regards to this, in relation to the movie, the adolescent behavior that is the most problematic is the management and supervision of Arnie by Gilbert and his siblings. By shifting the focus from the children's management of Arnie's behavior to help improve relationships within the family would be an effective first task. Task number 2 is adolescent alliance building. So in this task, the adolescent discusses with the therapist what caused the damage in regards to trust between the adolescent and the parent, and what has caused the impairment and attachment with their parent as well. So in regards to this movie, I feel that both Gilbert and his sisters can take part in this task. Each of them can discuss with the therapist what role that their mother's depression has had on their attachment with her. Task number 3, parent alliance building. The parent meets with the therapist to discuss current stressors and their own attachment history. Bonnie would meet with therapists to discuss current stressors such as losing her husband, her eating disorder, and the management of Arnie's behaviors. Bonnie also has an opportunity during this task to discuss her attachment history and how that affects her parenting. In regards to task number 4, repairing attachment, this is when the adolescent, young adult meet with a therapist to discuss the commitment and trust in the relationship. And there's also an opportunity to discuss unmet needs between them and their parent. So in this movie, the repairing attachment task would be an opportunity for the children to discuss unmet needs with both Bonnie and a therapist, just as in task number 3. The therapist can also help Bonnie find ways to be more supportive of her children. And then task number 5 is promoting autonomy. So this task involves including additional family members and supports to meet with therapists to help establish problem-solving skills. So during this task, family support such as Becky can be a helpful support to help family members solve skills in regards to the management of Arnie's behaviors.
So the clinical concerns in What's Eating Gilbert Grape are attachment ruptures and emotional unavailability, parentification, enmeshment and disrupted family hierarchy, unresolved grief and loss, shame and identity conflicts, and emotional suppression and communication breakdown. So attachment ruptures and emotional unavailability. The concern is the mother, Bonnie Grape, is severely depressed and emotionally disengaged. This is due to her husband having a death by suicide, societal stigma about her weight, and having the burden for caring for her children. Bonnie is emotionally withdrawn and physically immobile, causing her to be unable to meet her children's emotional needs, especially Gilbert. This creates a profound attachment rupture. Due to this, Gilbert has developed an avoidant attachment style, which is the protecting themselves, which he's protecting himself from further disappointment by rejecting or not accepting to be loved or supported by important others, like his mother or his siblings. Arnie's care also impacts the Graves family's emotional availability for one another. The family centered around Arnie's needs due to his neurodevelopment condition, and this honestly overwhelms the family, but especially Gilbert. And this has caused there to be limited space for emotional connection between the family members. So, parentification, enmeshment, and disrupted family hierarchy. So the concern is Gilbert takes on the role as the primary caregiver for Arnie and the whole household after his father's death, and his mother's emotional withdrawal. The parentification impairs his development, and when he tries to have intimate relationships. Gilbert's caregiving prevents his younger siblings from forming secure attachments due to their mother not being in their life now. And in a relationship characterized by parentification, the parent is typically unwilling, just like Bonnie is, to be responsible for the caregiving, which she then put onto Gilbert or he took onto himself. Through the use of the attachment-based family therapy, if used with the Grape family, family roles could be restructured and appropriate boundaries could be set. Gilbert could explore more of his identity, interests, and overall life if his mother took back her role as a caregiver. Also, attachment-based family therapy structures goals around creating appropriate family roles and boundaries, which allows the parent to take on this security. So, unresolved grief. There is silence around the father's suicide, and all members don't openly grieve the death. Bonnie detaches from the family, shown by detaching and binge eating as her coping mechanisms. To deal with the loss, Gilbert becomes emotionally distant, so losing a loved one causes the attachment system to be activated, which then begins a rise of emotional and behavioral responses to seek proximity to others to relieve stress. This can't happen for Gilbert, for he is emotionally distant from his mother and is acting as a parent to his other siblings. Arnie deals with this by acting out in dangerous ways, for example, climbing the water tower multiple times within the movie to seek attention. And the family can't follow the guidelines of attachment-based therapy due to there being no secure relationships within the family. And also, the individual who is the mother during this time is supposed to be close to her children, which she is not because she's living with unresolved grief. So, shame and identity conflicts. The concern is Gilbert is struggling with his identity because it is broken between external stigma, so his family's societal position in their small hometown, and internalized shame due to his unmet needs. This stigma and shame are greatly raised due to the Great family living in a small judgmental town, and Gilbert is taking care of his neurodivergent brother, and his mother is severely depressed. These cause him to become invisible and isolated within his own life. He also refrains from talking about his emotions in order to survive and take care of Arnie, which causes distance in his other relationships, like the relationship he's trying to have with Becky. Within attachment-based therapy, the use of emotional processing would be helpful for Gilbert to be able to feel more like himself and express his emotions better to those who care for him. Productive emotional processing involves assessing, connecting to, differentiating between, and expressing adaptive and often vulnerable emotions. So Gilbert's sense of self is built around meeting others' needs, but not his own. It can be noticed that Gilbert wants to leave and start a different life for himself, but doesn't due to feeling guilty and loyal towards his family due to taking care of his siblings, like Arnie. An emotional suppression and communication breakdown. So the concern is the Great family rarely discusses emotional issues. So the family environment is noticed to be built around emotional suppression, avoidance, and task-focused survival. Due to these factors, the Great family is greatly disconnected and distressed in many ways. Attachment-based family therapy encourages families to emotionally disclose to one another in a safe environment. If this action is done by the Great family, they could possibly stop avoiding one another and express these suppressed emotions they have properly to heal their emotions with one another. Also, assessing these primary and vulnerable adaptive emotions provides adolescents and their parents with better information about their needs to become healthier within their interpersonal exchanges. Gilbert suppresses his emotions around Arnie, which shows that there needs to be more communication so that the family can talk more and be related to one another. And these are our references.